Welcome to How to Research, Design, and Disseminate a Social Media Health Campaign, the Drink Less for Your Breath initiative. My name is Merlene Tucker, and I'm here with my colleague, Jeff Bornstein. Together, we'll be running this Dialogue for Health web forum. Thank you to our partners for today's event, the California Breast Cancer Research Program, the Alcohol Research Group, and the Public Health Institute. Now, it's my pleasure to introduce today's moderator, Dr. Peggy Reynolds. Dr. Reynolds is an epidemiologist and adjunct professor at UCSF Helen Diller Family Comprehensive Cancer Center. Welcome to Dialogue for Health, Peggy.
Thank you. And I think we're going to lead off this with a couple of questions for the participants. First poll is, who are you? And here's the poll that should be popping up on your screen. I'd like to invite you all to let us know. Choose all that apply. If you have multiple roles, give you about a minute to do that, and then we're happy to share the results. Quite a mix. And it looks like we have quite a number of participants that are really active in terms of communicating. So it'll be very interesting to hear what you have to say to us when we get to the Q&A session. Why are you here? What is it you really would like to get out of this session? Well, I hope that we'll be able to provide with you some very interesting results from this project on learning how to develop social media campaigns, since that seems to be the majority of responses. I'd like to just do a moment to give you a little background about this project in general. I am quite delighted to have been able to have been a co-investigator on this overall project. This was funded by the California Breast Cancer Research Program. As you can see, the mission of CBCRP is to prevent and eliminate breast cancer by leading innovation, research, communication, and collaboration with both California scientific and lay communities. This particular project is part of a special initiative on policy by CBCRP. It was a collaboration between UCSF and the Alcohol Research Group, Public Health Institute, and also included work with La Clínica de la Raza and Lauren Wall Design. In general, the aim of this project was to raise awareness among young women in California that alcohol use is a risk factor for breast cancer. So for our first speaker, Dr. Sharima Rasanayagam is the Director of Science for Breast Cancer Prevention Partners. As such, she works to ensure that the organization continues to be a national leader, as it is, in science-based environmental health advocacy. She oversees all of the organization's science-related activities, including monitoring and interpreting emerging scientific research, representing the organization in key scientific bodies, developing and managing science-related program and policy initiatives, and providing scientific guidance on the development of new programmatic initiatives. We were delighted to have her as a member of our external advisory panel for this particular project. And with that, Sharima, have you go ahead and start screen sharing for your presentation.
Hi, so thank you, Peggy, and thank you, everybody, for joining us today. As Peggy said, I was on the advisory group of this project, and I think they brought me on because Peggy was on an advisory group for a project that I did, which was Paths to Prevention, which was our report, which again was, which I'm going to tell you a little bit about in a moment, where we looked at a number of risk factors for breast cancer, including alcohol. And the team asked me to come on today to talk about the science that links alcohol and breast cancer and what we found in the about alcohol and breast cancer from doing that report. So next slide. So just to tell you a little bit about Breast Cancer Prevention Partners. So we are a nonprofit advocacy group focused solely on primary prevention of breast cancer, and in particular on eliminating toxic chemicals and radiation in our environment that is linked to increasing rates of breast cancer. There are a lot of really great organizations out there working to improve treatments for breast cancer and to improve early detection, but at Breast Cancer Prevention Partners, we're looking at primary prevention, which is starting the disease before it starts. So why primary prevention? Well, as many of us know, 1 in 8 women in the US will be diagnosed with breast cancer in her lifetime, and that the majority of these women have no known genetic risk factors for the disease. And as we've seen, Breast Cancer Prevention Partners, we've been around almost 30 years now, and there has been over that time more and more evidence linking breast cancer and chemicals and exposures in our everyday lives, in our food, in our products that we use, in our air and our water, which are linked to an increased rate of breast cancer. So a little bit about this Path to Prevention report. This is a report we put out in September last year, and it was funded by California Breast Cancer Research Program. Peggy was one of our advisory committee members. And this was a 4-year project in which we were asked to look at all of the factors other than genetics that were linked to rates of breast cancer in the state of California, both protective and risk factors. And the whole idea was to come out with interventions that could be done at a community level, at a state level, at a city level, at an institutional level that could decrease exposures linked to breast cancer and promote protective factors. And what was different about how we approached this was A, we were looking at primary prevention of breast cancer. B, we looked at the science. Everything I'm going to talk about is based on peer-reviewed science, and we reviewed all of the science on exposures in breast cancer up until 2018. But we also talked to communities across the whole of California about what they were experiencing and what might work in their communities. And so it was this marrying of community wisdom with the scientific research that was really important, and that dialogue with communities at every step of the way. And then we came up with over 300 policy initiatives and systemic interventions to address breast cancer exposures. So when we talk about systemic interventions, what we were doing was, rather than what we normally say is that, that people should exercise more or that they should eat a healthy diet, what we said was, no, what is it that we in the community or at state level can do to make that healthy choice the easy choice? How can we ensure people have healthy food available in their neighborhood that they can then buy and consume? How can we ensure that they have a safe place to exercise? So those 3 things: primary prevention, involving the community, and looking at systemic interventions that were not individual based. So when we did this, as I say, we went further than chemicals and radiation breast cancer. We looked at all of what was in the literature about breast cancer and factors that might be affecting rates in California. And there were 23 that we came up with. We have 23 sections, and in each of those sections, we go through the science and we go through potential interventions to address them. I am today only going to talk about alcohol, but you can go to our website, bcpp.org, and look at all of these. We have sections on all of these on our website. So talking about alcohol and breast cancer, which is what you guys all want to know about today, and what we found. As I say, we did a literature review, and to tell you the truth, alcohol was just one of the factors with the strongest evidence of a link to breast cancer. And that evidence is built up over many, many years. And we now know that alcohol consumption increases a woman's risk for breast cancer. And there's considerable research that shows that the more women drink, the higher the risk, and that even light drinking increases risk of breast cancer. And there's some studies say that any alcohol increases a woman's risk of breast cancer, but mostly they've been looking at more than 10 grams of alcohol per day. And people don't really know what that means. And so there's this little illustration we have here. And now these are what would be typical drinks. Well, actually 5 ounces of wine is a small drink, a small glass of wine to most people. And each of these would contain around 14 grams of alcohol. So more than what a lot of the minimum in these studies is. So even that amount of alcohol will increase your risk for breast cancer. And so there was a really great meta-analysis of a bunch of studies that had been done before that actually compared to zero drinking. Most studies just look at compared to an occasional drinker, but this study showed that even an occasional drinker, that's somebody who has less than 10 grams of alcohol a week, which is less than a drink a week, has a small, 3%, but significantly increased risk of breast cancer compared to somebody who doesn't drink at all. This is all in women. And that as you increase the amount that a person drinks during a week, it increases the risk of breast cancer to the highest levels. And these are not significantly different. Actually, at the highest level, you're getting over a 30% increase in risk of breast cancer. So the other thing people ask about is binge drinking. And yes, unfortunately, binge drinking does seem to be particularly harmful to health. And binge drinking here was defined as 4 or more drinks at a time and perhaps not drinking at all the rest of the week or the rest of the time. And a couple of studies that we've included here have shown that binge drinkers have a 29% higher risk of breast cancer compared to those who have low levels of drinking. And again, as I say, low levels, people who have a low level of drinking have even a slightly higher risk than people who don't drink at all. And then the other thing that's really important to look at is racial difference and also subtype differences. Breast cancer isn't a single disease and it doesn't affect all people equally. And there's actually been very limited research on alcohol and breast cancer on looking at different racial groups, but what has been done does seem to indicate that Black and African American women may be at a higher risk of 4 specific breast cancer subtypes, and these are the hormone receptor negative breast cancers, and in particular triple negative breast cancers. And with triple negative breast cancer, it's a particularly worrying subtype as it is more aggressive and has fewer treatment options, and it does result in higher mortality than some of the other subtypes of breast cancer. And maybe one of the contributing factors, the fact that African American women and young women are more likely to be diagnosed with triple negative breast cancer, maybe one of the factors contributing to their higher mortality from breast cancer. And so drinking 7 more drinks per week, 1 drink a day, increased women's risk of developing one of these hormone receptor negative subtypes of breast cancer by around 30%. Depending on the 30 to 40%, depending on the study you looked at. So it's pretty clear from the scientific evidence that there is a direct link between alcohol consumption and breast cancer. And so as an intervention, reducing and limiting your own consumption of alcohol beverages is extremely beneficial. Any amount you decrease is beneficial. But for policymakers, what we put into the Path to Prevention report was it would be really important to enact public education campaigns to increase awareness of the relationship between breast cancer and alcohol. And that was why I was so happy to be asked to be on the advisory committee of this group, because this is exactly what we were calling for. People really don't know about this link, and it's important that they do, because it's a very well established one. Other policy initiatives could be to implement measures to further reduce alcohol consumption with further increased taxation, and also limits on alcohol vendor location and hours. In particular, we were recommending to make sure that young people, especially school-age children, were not exposed to alcohol through vendors being near schools or being open during school hours or after school. And then expanding the research into links between breast cancer and alcohol consumption to further look at especially those possible racial differences, and also the effectiveness of public health efforts to reduce consumption, to seeing how these public health information campaigns could work and to use the best methods possible. So if you would like to learn more about all of the other factors that we talked about in Path to Prevention, please come to our website. We also run the campaign for safe cosmetics if you want to know about personal care products and breast cancer and other health effects. And also come and help us. We're always doing actions that we need help, we need people to sign petitions and to be part of. We recently did a actual with the Consumer Federation of America. We put forward a petition to the Alcohol Tax Bureau, asking them to put a cancer warning on alcohol, just like there is on cigarettes, not only for breast cancer, but for colon and a number of other cancers. And follow us on social media. Thank you so much. And I will stop sharing.
Thank you, Sharima. And so following that, we have one more poll question for you all. And did you know that alcohol is a risk factor for breast cancer? I'd like to invite you to all respond to the poll. And in a minute, we'll see what you all have to say. Okay, our participants pretty much knew about this. So our focus clearly is going to be on how to get the message out. Thank you all for participating in that poll. For our next speaker, now that we have gotten a little background on the science itself, we'll have a chance to hear from Bill Kerr. He is a senior scientist, and he's director, actually, of the National Alcohol Research Center and the Alcohol Research Group Public Health Institute. He is a co-investigator on this project, Drink Less for Your Breasts. His work focuses on alcohol measurement methods, drinking patterns and trends, and mortality studies. He's also researched the impact of cannabis legislation and how alcohol taxes impact consumption. So with that, Bill, could we get you to share your screen?
Good morning, everybody. So I'm going to be giving a quick overview introduction to young women's drinking and trends in the US recently and currently. This is not, there we go. So I like to frame, we're going to focus on drinking trends and surveys because that's the only way that you can really look into important subgroups such as young women like we're focusing on today. But I like to put that in the context of all of the alcohol sold, because surveys don't necessarily capture everything that there is to capture, and they may not be comparable over time. And of course, I could go on about that, but they're very useful for certain things. But we want to think about what we know maybe more objectively. And what we know is that alcohol consumption has been going up since the mid-90s, and this continued through 2019, we know, and we're pretty sure that it went up even more in 2020 during the pandemic. So alcohol is a significant issue in the US, and it's one that reduced from the 70s, but is now growing back in a concerning direction. And if you look at the gray and the blue bars, what those show is that at the same time, there's been a shift between beer and spirits. So the gray is beer and the blue and spirits. And so in recent years, we've had some, spirits has been rising quite quickly with beer declining. So there are some beverage specific aspects to trends. And just so you can understand this a little better, you can see my note that there are about 500 drinks were consumed in 2016. So it's a little bit more than that now. So that's on average for every person, there were that many drinks sold. So that might seem like quite a lot to you, or maybe it doesn't seem like that much. There's 365 days in the year, right? But just to put that in something that's maybe a little more understandable than gallons of ethanol. In the surveys, we have certain ways of asking about drinking that, they vary by survey, but ours focuses on getting at how much people drink in different occasions, or the most that they've drank in the past year, how often they drink 12 plus, 8 plus, 5 plus, and then lower amounts. So we can capture those heavy drinking occasions. And then we build alcohol volume out of that. And we also separately ask about wine, beer, and spirits so we can understand some of the key aspects related to beverage specific drinking. So Sharima already talked about the definition of a standard drink, but I always also like to point out that there's very wide variation in the drinks people actually have. And some people's drinks are quite small, and others' drinks can be 2 or 3 times the size of the standard. And and the factors include gender and age, with younger people having bigger drinks, but also context like bars and home and the kind of drink you have and all sorts of other things. These histograms are from research we did actually going to bars and measuring the drinks that we bought there. And the red lines are the standard drink size. You can see almost all of the drinks were larger than standard drinks that you would drink in bars and restaurants. So that's always something that's important to keep in mind, and even interpreting our findings from surveys that the drinking actually may be more than it seems from people's self-report. So how consumption changes over age, I just wanted to give a quick angle on that. I don't need to explain maybe age period cohort modeling, but it attempts to pull out the age pattern from other factors that influence people's drinking generally. And I think the key thing here is that women in their 20s drink the most and have the most 5+ days. Some other measures, it might be a little steeper, focusing on women 21 to 25 being the most, but it's less at younger ages and quite a bit less at older ages. So about 50% more 5+ days in the 20s compared to the 40s or the teens. So the key results I want to give from our latest, that include our latest national alcohol survey, are these, and then I'll give some other perspectives from that don't include our most recent data, because that we're still working on some of that. But so a few key points: 70% of 18 to 24 women in the US were current drinkers in our most recent 2 surveys since 2015, and that's up from 63%. So more young women are actively drinking in more recent years. The alcohol volume, so the number of drinks in a year that's reported on average among women in this group, peaked in 2015 compared to prior surveys, and it was a little bit lower in 2019-20, 30 drinks lower. So there's some good signs for young women in the recent trends, but compared to all of the earlier surveys, 2015 and 2020 were the highest. So we're still at historically high levels of drinking, even if there is some evidence of improvement recently. And 5+ days similarly had peaked in 2000 and again in 2015, and have come down a little bit from that, which is good. Though we don't know exactly what happened during the pandemic. I guess I should clarify, this survey ended in April of 2020. So it goes a little bit into the pandemic, but it's asking about past year drinking. So it's really focused on drinking prior to the pandemic. And we have another survey that we're about to learn quite a bit more about drinking during the pandemic. So stay tuned for that. And just some other perspectives on young women's drinking. This is 18 to 29, but we were able to look at white, Black, and Latina drinking, and you can see that they do differ, and these are smaller groups, so the estimates bounce around a little bit. But notably, in 2015, we saw big increases for all 3 groups, and that's something that is a big concern. And I think it's not any specific subgroup that's included in this increase. And just at the bottom, I put men's drinking, so we can see young women are not drinking as much as young men, but they are getting closer. Whoops, I went, sorry, the wrong way. Look at the top line of all these lines, and it says something about beverage choice, that young women 18 to 29 tend to have the most balanced beverage choices. They drink all the beverages, beer, wine, and spirits. We heard that in our focus groups for this study as well, that they were drinking everything. If anything, spirits is going up, and that's a big concern, because we know that's linked to a number of health and safety problems. And for our 2020 survey, we saw that about half the women drank wine, half spirits, and about 40% beer. So I think that idea that they're drinking everything is still there, and something to keep in mind. We also have seen in the increased volume this is for all women, but young women contribute disproportionately to these heavy drinking occasions, that the increases from 2005 to 2015 really were driven by what we call high intensity and heavy occasion drinking. So these are, this is a big increase in episodes over 5+, which includes increases in episodes of 8+ and 12+ that are very heavy occasions. And those are more dangerous for everything, including breast cancer. And that's something we want to keep track of as we move into the future. And then finally, I just wanted to give a few points from the Monitoring the Future survey, which covers high school students but also follows them into college and beyond that. And in the US, we've had really substantial declines in teen drinking for both men and women since 2000. And that includes, from 90% in the 80s to 60% of 12th graders being current drinkers. So a lot fewer 5+ days down to 15% from 40% in the 80s. This is for all 12th graders that were in the survey, and a lot fewer have been drunk. But those improvements don't seem to have translated into decreases for young women and young men in their 20s. So that's something that's somewhat puzzling, why we're getting these improvements that are occurring in other countries as well, but it's not necessarily continuing. And that's sort of shown by the college age Monitoring the Future results, that there's some small declines in drinking and daily use, but 5+ for women has stayed the same. It's dropped a bit for men, so they're now actually the same prevalence of 5+ in the last 2 weeks for college women and men. So that's a convergence that's surprising, I think. And 10+ drinks hasn't dropped either. So I think so that kind of confirms what we're seeing in the NAS sample, that young women are drinking at historically high levels of concern. Thanks.
Thank you, Bill. And I want to remind everybody to post questions in the Q&A. I see that there are a few questions about getting access to these slides and presentations. And so these will be posted on the Dialogue for Health website. And I believe there will be a link from the Drink Less for Your Breasts website. So we will certainly have multiple opportunities for you to be able to revisit some of these presentations. For our moving right on to our next presentation, actually, our principal investigator. So you've got the backdrop on alcohol as a risk factor for breast cancer, on drinking patterns in young women, and for this particular project, this was the focus, was young women now getting the message out. And so Priscilla will be able to give you a little insight into the process. She is a scientist at the Alcohol Research Group, Public Health Institute, and principal investigator for this project. Her research explores relationships between immune function, health, and alcohol use to address alcohol-related racial ethnic health disparities in the US. Her work also examines ways to improve participation of racial ethnic minorities in alcohol research, collecting biologic samples. So Priscilla, do you want to start sharing your screen?
Great. Can you see and hear me?
Looks good.
Excellent. Thank you, Peggy, for the introduction, and to Bill and Shrima for their talks. And thank you to all of you for being here. I gotta say, I'm just really tickled that so many people are interested in this topic in general and in our campaign in particular. So I'm really happy to have this opportunity to share with you the research and development work that we did to develop our messaging and our strategies for the Drink Less for Your Breast campaign. So I'm going to talk about what we did to prepare for this social media health campaign. And I'll begin by describing what our plan was. so how we envisioned carrying out this development. I'll talk about some of the data that we collected and how that data collection went. And then I'll spend some time on what we found from our data collection efforts. And as I'm describing what we found, I'll talk about how that related to how we were thinking about our messaging and our dissemination strategy for the social media campaign in particular. And I'll end with just one slide about some of the lessons we learned and some things that other people might want to consider if they're doing their own social media health campaign. And I want to say that this isn't going to be a very researchy kind of presentation. I'm not going to show you a lot of tables and graphs. I'm not going to go into detail about our analytic methods or what our sample looked like. But of course, please feel free to ask me those questions either in the Q&A or contact me after the webinar. And I think it's also important to note that while the Alcohol Research Group has a lot of expertise in alcohol research, we've been around for about 60 years, and we have some communications expertise, we had never undertaken a social media health campaign before. So I really hope that you can learn from our experiences and that you'll find what we're presenting useful. To quickly synthesize our motivations for conducting this research and this project, and to build on what Shrima and Bill talked about, we know that there's a clear link between alcohol use and breast cancer. And we know that drinking is common among young women, even with the changes that we've seen recently at the population level. And importantly, we also know that about 3 out of 4 women don't know that alcohol increases their risk of breast cancer. A study by Kushalani that was published last year reported that 75% of women between the ages of 15 and 44 didn't identify alcohol as a risk factor. So these 3 issues together, I think, give us really compelling reasons for pursuing efforts to increase awareness about the link between alcohol and breast cancer at this time, and among young women in particular. So for this project, we had one goal: to raise awareness among young women in California that alcohol is a risk factor for breast cancer. And we did it in 2 phases. We had a research phase and a dissemination phase. The research phase took place last year between January and September, and our dissemination phase began in November of last year and is ongoing right now. And I'm going to talk just about the research phase, and Diane, our next talk, will talk about dissemination, focusing on how we implemented the social media campaign. So as we often do, we begin with a plan. We had 3 components to our plan. First, we did a rapid review of the literature. Rapid because this wasn't a very long project. We still apply principles of systematic review. And we looked at recent epidemiologic evidence for the link between alcohol and breast cancer. We looked at recent trends and current drinking patterns among young women. And we also looked at health communication strategies and other campaigns that have addressed breast cancer prevention or alcohol risk reduction. As far as I know, this is the first time a campaign about alcohol and breast cancer has been done in the US. In other countries, namely the UK and Australia, they have undertaken similar campaigns. So we looked to them for some inspiration and included them in our review. I'm not going to talk about the review anymore, but it is one of the materials that's available for free on our website. So if you're interested, I encourage you to look at it. Focus groups and a survey were another component of our plan. We conducted focus groups with young women, which we defined as being between the ages of 18 and 25, and also gave an accompanying survey. And another important component was our advisory group, which was made up of representatives of breast cancer advocacy organizations and alcohol risk reduction groups. And they served to help inspire our messaging and our dissemination strategy, and also to help us as we developed and revised our messaging based on feedback from our focus groups. This is what our plan looked like over time. As I mentioned, we did this from January to September of last year. We began by preparing some initial draft messaging. And when I say messaging, I'm talking about what we thought were going to be social media posts. We convened our advisory group and got some input from them on these initial drafts. We then conducted a first round of focus groups. We did it with 5 focus groups. We then revised our messaging based on feedback, conducted another round of 4 focus groups, did another round of revisions, and met with our advisory group. So I think the take-home message with our plan is that we really went through several rounds of development and revision based on feedback from our focus groups and from our advisory group. As you may have noticed, we conducted our focus groups in March and April, which was an important time in our history. And we had originally planned to hold our focus groups in person, as is most common with focus groups. But given the onset of the COVID pandemic and lockdown in Northern California, where we're located, we had to alter our methods. So like everybody else in the time of COVID, we went online. And moving focus groups online had a couple of implications for the number of focus groups, how we did our recruitment, and who we could recruit. The literature on conducting synchronous online focus groups suggests that you have between 6 to 8 participants per focus group. For in-person focus group, the literature suggests about 10 to 12. We originally planned on conducting 5 focus groups with 12 women, so a total sample size of 60 women. And to do that with focus groups, we had to double the number of focus groups. So that had implication for some of the use of our resources. Our recruitment strategy also had to change because originally we had planned to do some in-person recruitment and then some online recruitment, and clearly we couldn't do any in-person recruitment, so we went completely online. Being online in terms of our recruitment and holding the focus groups also had implications for who we could recruit. Because originally it was just women in the Bay Area that we were going to invite to attend a focus group in San Francisco. But now we could recruit women from all over California, and we did. And so we had participants from as far north as Arcata and as far south as San Diego. So it was work and a little stressful to pivot really quickly from in-person to online focus groups, but it did also have some benefits. Let's talk a little bit about the data that we collected. Clearly, we collected some qualitative data from our focus groups, and we also collected some quantitative data via our surveys. And here's kind of an overview of the surveys that we collected. When we advertised and when one was interested in participating, she was directed to an online screener form. We used SurveyMonkey, and it was really brief. It took like 2 minutes to fill out. And we just wanted to verify their age, that they identified as cisgender female or non-binary and born female, and their drinker status. And really the meat of our quantitative data collection came from our pre-focus group survey, because we asked more questions about demographics. We asked about their past year alcohol and cannabis use, their use of substances while sheltering. We asked about how they access healthcare information, who they trust for healthcare information, who they don't. And we also asked about some general questions about alcohol and health and their understanding of it, and some questions about alcohol and breast cancer in particular. The post-focus group survey was really because we had never conducted online focus groups before, and also because it's not quite as done in the literature, and we wanted some information for understanding how this methodology worked. So that was the purpose of the post-focus group survey. Oops. For our focus groups, there's 3 topics that we addressed during the focus group. The first topic was alcohol use. We asked our young women about why they drink, who they're drinking with, when they're drinking, and what changes in drinking they might have experienced, because we were interviewing them at the beginning of the COVID pandemic. We also asked them about their thoughts and feelings about alcohol and breast cancer. And as I'm sure you know now, this is something that a lot of people don't know. This is really new information. And because we want to get it out there, we wanted to know how young women were going to react to it. So we asked them how it made them feel to learn that this behavior that's quite common can lead to this health outcome. And then at the end, we moved on to our messaging, and we told them that we're developing a social media campaign and we want their feedback on what we think will be posts for a social media campaign. At the time, we weren't certain on what platforms we would be using: Instagram, Facebook, Twitter, all of the above. So we just said vaguely social media. And we wanted to know what they liked and what they didn't like, what maybe was confusing, or what meanings they got from our messaging, and just their also emotional reactions to the messaging. So what did we learn, and how did we use it? From our focus groups, there were 4 themes that were most salient and that I think really influenced how and what kind of messaging we developed and how. So first of all, message clarity. And I understand that this might seem a little bit obvious, but this has a couple of different components that I think were really important for us to consider and that we used when we developed our posts. First of all, the link between alcohol and breast cancer is the new piece of information, and that needed to be front and center. They didn't want any extra text. They didn't want clever phrasing or taglines. They really just wanted to know that alcohol increases their risk of breast cancer. Also, this came up quite a bit. It had to be a brief and direct message because you have very short amount of time to get their attention, particularly on social media. So we'd heard things from our young women like 3 to 5 seconds to get their attention on social media max. Also, we prefaced our discussion about our messaging by saying that we're not professional graphic designers, and that we really wanted their input on the idea behind the messaging, but without fail, they commented on the fonts and the placement of the text and what was in the background of the image and the colors used. So there was a real focus on the aesthetic and the design that affected how they perceived the message and how easily they understood it. Relatability, this was another really salient theme. The young women wanted to see themselves reflected in the posts, and they wanted to see that in a couple of different ways. First, they wanted a diversity of women to be shown, and not just racial ethnic diversity. They wanted women to come in all their forms. They wanted to see young women like themselves, and they wanted to see them engaging in activities that they could say, hey, yeah, that was me. I do that regularly. So it was important that they could see themselves in these messages and connect with them. We asked about whether or not they preferred pictures of real women, like actual photos versus graphics, and there was a preference for photos, but graphics they were also okay with as long as they were done well. Opportunity. This hit on ideas of empowerment and positivity. For example, for this post, one young woman said that, I love that this one doesn't attack anyone and brings the narrative back to ourselves as women. I'm going to make this choice. They didn't want posts or messaging that blamed the alcohol industry or advertising. They wanted the story to be about themselves and about their own decisions and ability to make informed decisions. So that really played into our approach to what the tone and the feel of what kind of messages we were putting out there. And kind of relatedly, variety came up. So one finding from our focus groups that I think is most interesting is that we found differences in message preference by women who drank recently or were reported heavier drinking in the last month compared to women who were either lifetime abstainers or who were very light drinkers. Our women who reported heavier drinking we're more inclined to have messages that were kind of negative consequence based really compel them, that those messages really resonated with them. Whereas for our women who were lifetime abstainers or lighter drinkers, they didn't really get anything from those kind of messages. Also, with variety under that, I think when you're trying to reach a really broad population as we are, young women in California, you want to consider language and make sure that you are reaching as wide a group as possible. So we also translated many of our messages in our website into Spanish. And as you can see, some of our posts were kind of lighter and cuter, and some of them were a little bit darker. And I think that that really helped us reach more women effectively. From our survey, a couple of things that were important when we were thinking about our messaging are shown here. One was beverage type, and Bill hit on this. We wanted to make sure that we weren't going to put up images of alcohol that women couldn't relate to. So we asked about what they were drinking. And this is consistent with what Bill showed, that young women are drinking everything. 70% reported that in the last year they had beer or wine at least once. 77% reported that they had spirits. So all beverages could be shown in our posts. We asked about where they got health information the last time they did a search for health information, and 93% said that they went online. So clearly we needed to have an online presence that would appeal to young women and provide them with information that they could trust. We asked what sources of information they would trust. Specifically, we asked where they would go to learn about the link between alcohol and breast cancer that they would believe. And 55% reported health workers or their own primary care physician, and about a quarter reported breast cancer advocacy organizations or university affiliated organizations. Finally, we also asked about their knowledge about the link between alcohol and breast cancer, and 64% reported that they either thought alcohol was not a risk factor for breast cancer or that they were unsure. So a little lower than what we've seen in other studies, but still kind of consistent. And this, of course, isn't a representative sample. So thinking about all of that together and how that influenced our plan for dissemination, we realized pretty early on that we need help. The focus on messages being really clear and direct and concise and looking really good meant that we needed professional graphic designers and health communicators. And we just did simply not have that expertise. And relatedly, we needed a really engaging website, partly because, of course, they're going online to get this information, but also because if you do a Google search for alcohol and breast cancer, you're going to get a billion hits in 0.01 seconds. But a lot of it didn't feel very tailored or accessible to young women. And so we wanted to produce a site that they would want to go to and that would appeal to them and would have a relatable and accessible tone. And finally, we learned from our data collection efforts that we need a lot of messaging. You really need a variety because different types of messaging are going to resonate with different groups. And when you're trying to reach a really broad population, you want to make things as appealing as possible. And also when I talk about variety, it wasn't just the posts that we were thinking of. We were also thinking, well, we need infographics and we need fact sheets and we need videos. We wanted to use various types of mediums to communicate this message because that's what our focus groups told us would be effective. So quickly, just a couple of lessons, some things that I might do differently if I did this again. I loved our focus groups, but in total, we did 13. We did 9 in the research phase and then 4 in the dissemination phase. And I don't think we needed to do that many. And I think this for a couple reasons. One, focus groups are fairly time and resource intensive. And you're going to reach saturation, or you're going to know new themes are going to emerge from the focus groups fairly quickly, maybe after about 4 or 5. And also specific to a social media campaign, it's not like a billboard or bus stop campaign where you're paying thousands of dollars for a few messages. And so you really want to make sure that these are going to be effective. For a social media campaign, if you put on a post and it doesn't get very many likes or shares, then you post something else. And maybe you spent $20 on that. So it's not a really big threshold for ensuring that your messaging is going to be good for social media. Um, and I would also recommend collecting all kinds of data. I think that that's something that was a strength of our project, that we had both qualitative and quantitative data, and also getting stakeholder feedback. Our advisory group was invaluable and helped us keep in mind that we're part of a bigger conversation. Yes, our goal is to raise awareness among young women about alcohol as a risk factor for breast cancer, but this also happens within a greater context of women who have had breast cancer and have undergone treatment. So this is part of a bigger conversation, and engaging with stakeholders can help keep us aware of that. And finally, get help as needed. I think when we talk about allocating resources, that was one of the best decisions we made, was to work with health communication designers on our messaging and on our website. I think we thought we would do it by ourselves. And when I say that now, it just sounds absolutely crazy because there's no way we could have. Just want to quickly show off our advisory group and acknowledge their excellent contribution. One you have already met and know. And finally, I want to say thank you to all of our collaborators and to you for being here.
Thank you, Priscilla. Well, that certainly gives you a flavor of this project. Before we move on to Diane, I believe we have one more poll. And here it is. Have you or your organization implemented a social media health campaign before? Let us know. We have a minute for that. Meanwhile, thank you for all of the questions that are coming in the Q&A. Some of these are logistics, indicating interest in getting a copy of the recording after this session, and some of the other materials that people have mentioned and referred to. So indeed, I believe, Marlene, you can correct me on this, Dialogue for Health will be posting the recording in a week or so after this session. And if we don't get to all of your questions, we will certainly be putting together some report on the Q&A and have a chance to get back to you on a lot of the kinds of questions you've asked. Some have been cited. Okay, kind of a mix, interesting mix, y'all. So some people who are quite experienced, some people who are getting into it. So thank you so much for participating in the polls. And this is the last, I believe this is the last poll that we're gonna be asking for input. And I wanna be moving ahead to our last but not least speaker, Diane Schmidt, who is going to be talking about the actual implementation of the media campaign. Diane is a senior communications specialist at the Alcohol Research Group, Public Health Institute. She spearheaded the social media campaign for this project. She helps guide Alcohol Research Group's dissemination efforts to ensure everyone has access to research findings. Her experience ranges from the operation of international educational programs to the promotion and implementation of patient-centered initiatives. And with that, Diane, I hope we can get you to share your screen and share a little bit about the implementation of this.
Thank you so much, Peggy. Before I begin, I just have to say that, of course, I'm having some internet issues today. It started last night, so if my video starts to freeze, our technician's going to stop the video and you'll just see a photo of me. So I apologize in advance. As we all know, in these Zoom times, these kinds of technical issues can happen. So I hope everybody can see my slides. And hear me okay. Okay, great. So as Peggy introduced me, first, thanks, Peggy, for doing that, and also to the previous speakers and everybody out there who's here. I'm really excited that so many of you have actually done social media campaigns. That's fantastic, and I'm hoping, at some point maybe we could have a conversation about it, because this was our first time, as Priscilla mentioned, and my first time doing a social media campaign as a communications person. So it was a huge learning and very interesting. So I'd be very excited to learn about your experiences as well. So I'm going to talk about how we did this, the implementation or the dissemination of the social media campaign. I'll talk about what we did, what we learned, and what's next. So 3 phases. We had a prep phase where we gathered the team, got our materials together, thought about the strategy, then we launched, ran the campaign, and right now we're in that final phase of the assessment and reflection. So I'll go through each phase and talk about that. So in the prep phase, one of the things I think throughout the whole campaign, as Priscilla already mentioned, we really had to keep in mind the goal. We kept, it was really difficult not to think about implementation or not to think about intervention, trying to get women to drink less, even though that's our message. Really what we wanted to do was to make women aware that alcohol is a risk factor for breast cancer. So we were thinking about that throughout the entire process, that the goal was really important, and also who we were trying to reach. So in prep, I'll talk about how we gathered our resources, we'll talk about the strategy, how we prep materials, and also how much we met. We met a lot, both within our own team, Priscilla and I, as well as with our external designers. So in terms of resources, this was a very limited funded project. So we set aside $2,800 for paid ads on social media, paid ads and promotions, and our campaign only lasted 6 weeks. It was a very short campaign, really testing the waters, seeing what we could do, seeing how many women we could reach. So most campaigns, as you probably all know, run a lot longer than that. So so it was limited. Part of that was due to budget. Other resources we had, as Priscilla has already mentioned, we had an incredible team. I just cannot say how much I appreciated so much effort that everyone gave to this project, and in particular our external designers, Ian and Lauren, who I'll speak about in a bit. And then also other suggestions that I learned along the way is you call in experts as you can. So we relied on our advisory panel. We relied on other people like from Zero Breast Cancer Project. And also we called in personal favors. So for instance, Priscilla has a friend who has a PR company in San Francisco, BoSpar. And they gave us free PR, which ended up getting us about $50,000 worth of free advertising. And that was huge. And that went across the nation as well. So we were really lucky. But even if you're a small organization and you're going to be doing a social media campaign, and you don't have those kind of contacts, reach to your family and your friends and get people to share and follow and do as much of that as you can up front. And I think that will help a lot in terms of gaining that reach. So in terms of the strategy, as Priscilla mentioned, when we talked to our focus group members, they really talked a lot about how they use Instagram to connect with their friends, and they use Facebook to connect with their family, which is very much what the literature was saying about this population, the Generation Z population. So we knew at the front that we needed to do an Instagram campaign. Now, not only is this our first social media campaign, Alcohol Research Group, our parent organization isn't on Instagram. So this was new across the board, both social media campaign and then also using Instagram to reach people. And then we also did a bit on Twitter. So we have an ARG account on Twitter. So we did some tweeting on Twitter, but we did not create our own Drink Less for Your Breasts profile on Twitter. We did use Facebook as well, and I'll talk about that as well, even though most women were saying that they only use it to connect with their families. In terms of the timeline, as Priscilla mentioned, it ran from November until the dissemination portion anyway, ran from November until April. It was a 6-week campaign. We actually posted on Facebook and Instagram 6 times per week, and that was initially for the first, I would say, 3 to 4 weeks. We were doing that on a regular basis. Then we started to decline the amount of posting we were doing, simply because the campaign was starting to wind down and we'd already built momentum. With those 6 days per week, 2 times posting on Instagram, once in the morning, once in the evening, and then we were doing daily on Facebook, daily on Facebook, and then 3 to 4 times on Twitter. Types of posts, we did single post, carousel, stories, and videos, and I'll go through that in a little bit as well. In terms of strategy, Ian, who is part of our design team, external design team, came up with our strategy. We had a lot of organic posts. That's what the OP stands for. Again, we were posting twice a day. ARG team came up with a lot of the organic posts, meaning that they weren't paid, they weren't promoted. The paid ones primarily were done by our designers. And you can see in the gap, there's a gap between February 20th and March 3rd, and I'll get into that in a little bit when we talk about our challenges. But as you can see, our strategy was really simple in terms of how we laid it out. We also left a lot of gaps in the calendar, and what we would do is we worked on the fly a lot. And initially, when we first started this campaign, I really thought that we would have all the posts ready to go, have all the messaging, everything ready before we actually launched. And we didn't do that. First, it was a resource issue in terms of time, but also realized that we really had to see how the social media campaign was going to go, what was going to resonate with women, what were they going to like, not like, and then be able to work on the fly as well. So a lot of gaps in the calendar, and that's how I recommend, if we were to do this again, that's what I would recommend that we do. So in terms of prepping those materials, as Priscilla mentioned, we had to have a website. We designed posts. We also did do video. So Ian has a great video company called Hurricane Images. Highly recommend them. He did 2 shoots. So we did one that was a commercial shoot, which I'll show you a graphic of it later, as well as interviewed young women about their experiences and about their thoughts about alcohol use and breast cancer, and turned those into 4 separate videos. And those we posted, and those videos did the best in terms of their reach. We had to have a website. Lauren came in and did our website, which is fabulous. I highly recommend going to it and checking it out. We had to come up with colors and look and feel of the website. Branding was something that came up in a discussion a lot with our team. I kept thinking that we needed to brand. I come from a communications marketing background. But as Priscilla mentioned earlier, really it was about having a lot of variety in our messages, and we realized we didn't have to brand. And actually, I think unless you're going to marry your social media campaign with a print campaign where you're going to do bus ads or posters or something like that, then you probably want to brand across the entire project. But we were just on social media, and as Priscilla mentioned, 3 seconds. We have 3 seconds to get someone's attention. So we wanted to have a variety. So we didn't actually do any branding. The consistency we had was with the colors from our website being part of our profile across all our social media platforms. Content for the website, as you know, content, it takes a long time to write, so we took some more time to do that. We translated, as Priscilla mentioned. We set up our profiles on our three platforms. Yes, we did use Pinterest. Haven't done a lot with it. That is something we still probably will do. Pinterest only because images will stay there, you know, indefinitely. So that's something we might build. We also collected hashtags ahead of time. So we created a spreadsheet in different categories of topics that our posts related to. We did a health topic, alcohol, breast cancer, that kind of thing. Had the hashtags ready to go ahead of time. Influencers and other allies, it's something that we actually didn't employ, which if we had a longer campaign, we would have. We had a list of celebrities and influencers we could have reached out to, but really because of time, resources, we didn't take the time to do that. But it's something that I think would work really well. We also came up with our own hashtags, which are there, you can see them. And then we also prepared a press release, of course, and pushed that out. And thanks to Priscilla's contact at BOSPAR in San Francisco, we had a lot of media attention. And also I have to do a shout out to PHI, our Public Health Institute, and their communications team that helped as well. Tools, and as probably you all know and probably all use Canva. I never used Canva before this project. Primarily I use Photoshop, Illustrator, you know, InDesign and all the Adobe products. Because we did so much on the fly in terms of creating our posts, we switched to Canva, and it just saved our lives. I cannot promote it enough. And we did purchase a pro version for our alcohol research group. And as you know, and if you probably use it, and if you don't use it, I highly recommend it. You know, everything is laid out. You don't have to worry about layout or design, and great elements and photos. So now we'll talk about the launch and run. So these are the types of posts that we did. We did a single post. So as you can see, this is a photo of Mirror Girl. This is the video that was shot, and this is a still that was taken from that and created a post for it. So we did single posts, video posts. Carousels, we actually started doing a lot of, and they were really successful. So I'll talk a little bit about that. We tried Instagram stories. Didn't really work for us. I'm not sure if we just didn't have time to investigate it and to use it, you know, in a way that would be effective. So I'm not saying don't use it. I think I'd be interested in exploring that a little bit more. So the other things to keep in mind when you're doing the social media campaign is monitoring. So it takes a lot of staff time, as you probably know, those of you who do this quite a bit, in terms of monitoring that on a daily basis. So we did daily checks of Instagram and Facebook. We did have predetermined ads. We knew when those ads were going to run, and we could schedule those. But we did so much on the fly. Priscilla, Dustin, who's also on our communications team at ARG, and I would meet weekly and do brainstorming sessions on Monday that often took a couple of hours, but really productive. And then we would go and design and write the content and then post. The other thing, of course, to monitor is your spending, and some of the, you know, there's a difference between the platforms and how that's monitored. And I'll talk about that in a little bit. Tools, we used Hootsuite at the beginning, the free version. I signed up for the pro version, the trial version. I ended up not using it very much, and that's primarily because we were using a lot of carousels and video. And as you probably know, if you use Hootsuite, you can get a push notification for carousels, but you can't actually schedule and post from Hootsuite into Instagram. So I found that cumbersome, and I just ended up doing everything on my phone. And then we also used, of course, we looked at Instagram Insights as well. And what I primarily started using was Facebook Ad Manager and the Business Suite to monitor in terms of insights, you know, reach, and look at those kind of, oh, sorry, I'm not sure what's happening here. Sorry, apologies. And to look at reach and how the ads were doing, so that we knew what to promote. Sorry, I'm having some computer issues here. So getting into purchasing ads, this is our first time doing social media, so we had no experience doing purchasing. What we found was when we looked at it over time, the Facebook ads were more expensive. However, they tended to have a faster, bigger reach when we did post ads. And as you probably know, Facebook Ad Manager works across Instagram, Facebook, and Messenger. So we did all three. Whereas Instagram promotions you do from Instagram itself. Yeah, so we found those to be different. I found the Instagram promotions work really well in terms of doing really quick promotions. It was easy to use. And we found actually over time, if we had a promotion that was running longer, it did a lot better than even some of the ads. Facebook was easier to manage budget-wise in terms of setting a target. Usually it would meet that target for a day. So if we had set it for $50 a day, it usually met that target. On Instagram, we found that if we set a target for, say, $50 a day for a promotion, oftentimes it would only be at $20. So it was a little more tricky to do with Instagram. We spent less on Instagram promotions, but it was just trickier to monitor. So in terms of what worked best, again, I found that over time, Instagram promotions work the best, or what Facebook calls boost. Mostly that was because we did video promotions and we let them run for at least 14 days. And then sometimes if we did a shorter promotion, we would re-promote it. So you'll see in the next slide how those promotions did. So Facebook ads had the biggest reach across all three programs, all three platforms. The videos had the most click-through and engagement. And again, like I said, the carousels did really well. Priscilla calls them edugrams. I'm not sure if I think that's her term, so I'm PMing it instead of TMing it. But they did really well, and I'll talk about those in the next slide. Some tips. And probably you know this if you're doing these kind of posting, especially with Instagram, is that we wanted it to be fresh content. We wanted people to learn new things. We couldn't just keep repeating the same message that, drink less for your breasts. So we had to come up with new content every week. And like I said, we did a lot of brainstorming sessions. In terms of the edugrams, these are some examples of what they were. So, they're a 4 to 6 panel post, and we came up with different topics that we thought women would want to know about, provided links to the website to get more information. But these did really, really well on Instagram. Women were engaging with them. Yeah, we were really surprised by that. So that's what we were coming up with every week, were new edugrams. This gives you an idea of how some of our promotions did. So this is a screenshot from our Facebook ad manager. You can see here that videos were our top performers. So this is our top performers across the entire period of time over the 6 weeks. Our top performers were the videos, with our top one being a promotion boost from Instagram and reaching almost 50,000 women. And when I say reaching, that means individual accounts. So individual women were reached using that post, which is quite something, I thought. So how did we do overall when we looked at the end of the campaign? So overall, what we were measuring was we were looking at reach, not impressions or click-throughs, primarily because, again, it was all about awareness. We wanted women to know this, so the more women who actually saw the message, we thought that was more a measure of our success than impressions. So over 343,000 women, individual women, received the message or saw the message. We had over 9,000 website clicks, and all those women were between the ages of 18 and 35 in California. We did increase the age range after the first week of the campaign, thinking that maybe we should target more, since that is a vulnerable population in terms of that drinking risk. But what we found at the end, when we look at the data, about 82% were still within that target range of between 18 and 25. And we spent less than $2,400, so we thought that was a success as well. And in terms of challenges, we got hacked. So that was the first thing, the first issue we ran into. We launched on February 18th. The hack came in on the 20th. And at that point, and it wasn't necessarily through the Drink Less for Your Breast website. We have no idea how it came in, but it came into our ARG, all of our ARG websites. We run project websites as well as our public site. And that was really problematic. So we actually paused the campaign. Our decision to pause the campaign was we didn't want to send the message out to women and then have women not have a place for women to go to get more information. We thought that was not responsible. So we paused the campaign. The other issue we had is that Facebook kept blocking our ads and posts. And that was primarily because it was alcohol based. And so usually if it happened, we would repeal it and it would go under review for several hours and sometimes a day, and then they would allow it to go forward. However, Instagram rejected our top post, which was the Just One More, the post that Priscilla showed you earlier with a mastectomy, and it's still under appeal. Our campaign's over and it's still under appeal, and I have no way of stopping that appeal. So pivots. So we came back online 2 weeks later. We moved our website host. We moved off the ARG host, and that was primarily because our IT team at ARG was just swamped with this hack. So we decided that our team would take the website itself and move it to a new host and host it somewhere else. We increased the security. If anyone's interested in what we did to increase security, let me know. We learned a lot about security. We appealed anything that Facebook blocked. And like I said, most of those came back except for our one post. We also tried changing the minimum age because this was an alcohol, this mentions alcohol and drinking. We thought perhaps it had to do with the minimum age being that we were reaching women under 21. However, we're not sure if that was really the issue. I really think it was because we were mentioning alcohol. So what would we do different? We would make sure our website is airtight. That was key. Again, might not have been the Drink Less for Your Breast website. We would allocate more time to manage the campaign. I think because it was our first campaign and we had a really steep learning curve, there wasn't a lot of time to really dig into the data behind the scenes to see what was happening, to see how women were engaging. So a lot of this was done really, really quickly. And I think if you can have some dedicated staff time specifically for I would say the beginning of the campaign, I think that would really be helpful. So critical things to have her do. So a fantastic team with a great leader. Priscilla was an amazing leader. We had a fantastic team, as I've already mentioned. Open communication. We had some disagreements. We talked things out. We met whenever we needed to meet. We had very productive meetings. As Priscilla already mentioned, ask for help wherever you can get it, friends, family. We were trying to find a shoot for our video, for instance, because of the pandemic. It was really hard to find a location. We were reaching out to friends to see where we could shoot it. Yeah, just find help wherever you can. Laughed and host a onesie meeting. We actually held a pajama party just because we were so tired. So, we had a lot of fun doing this meeting. And I have to say, choose your design consultants. If you use outside design consultants like we did, choose them wisely. We really did. Ian and Lauren are now family. We miss them and we had such an incredible time with them and they did such incredible work. So we are grateful to Ian and Lauren and Christina, who's an associate scientist at ARG, Dustin, who's on our communication team, and we were lucky enough to have an intern, Jennifer, helping us out as well. So next up for us, we hope to continue the project or at least continue something like the project. So look for upcoming information about that. Our website's going to be live for 2 years. So we're going to try to keep it fresh and exciting. We're going to continue to make resources available to all of you. So part of what we want to do today is also give you the website link where you can go and find materials. All the materials are free to use. We have the posts. We have, as Priscilla mentioned, we have the lit review available. We have all all the campaign materials there for you to use, including the videos as well. We're also going to try to publish some papers, and we're really going to try to catch our breath. And these are the links to the resources that are available. And I recommend going to the first one, which is the Drink Less for Your Breast Health campaign at our ARG site. That's where all the materials are. Check out the drinkforyourbreasts.org. And then also want to give a shout out to Lauren and Ian's companies, and also to BOSPAR. And if you have any questions, or if there's anything you want to talk through, just reach me at dschmidt@arg.org. And I would love to hear more about what you've done, and maybe we can do some shared learning. Thank you.
Thank you. As is so often the case, we are running out of time for Q&A. Lots of good questions, lots of good answers. Some of the questions I think have ended up being addressed as part of your presentations. And so since you mentioned Dustin as part of the communication team, I am going to give him an enviable task of trying to do a quick summary of questions before we wrap it up, and remind people that we will be making available the recording. And as you have heard from Diane, we're hoping that people will on this and move up and continue in a discussion with us. So Dustin, you have like a couple minutes to say something about questions and answers.
Okay, thank you, Peggy. This is very difficult. We've had so many wonderful questions coming in to our Q&A right now. They range a wide variety between the effects of alcohol on breast cancer, to the social media campaign, to focus groups. Let me just pull up a few. So Priscilla, is there anything that you would like to add? I saw a bunch of questions that came in about the focus group, multiple ones. Is there anything you would like to add about the process, or anything to kind of further speak to that process for this project?
Sure. People asked about recruitment, like specifically, if I can recall the question, where we recruited, because I mentioned doing it online, and we mostly used Craigslist, Reddit, and we posted on our social media accounts, Twitter and Facebook. But really, the big bringer in, of participants was Craigslist, which really kind of surprised me. I didn't realize that this age group was on Craigslist. I thought it's where people went to buy cheap furniture like myself. So that was really our big, really what worked for our recruitment. Were there other questions that you recall about the focus groups? I think I didn't quite say how many in the end, how many women we in total recruited, and over the 13 focus groups, it was 55 in total. So some focus groups only had a couple women and others had 8. And I will say, if you're going to do online focus groups, 8 is way too many. I would aim for like 4 to 6. I feel like that's the sweet spot where you can really engage and everybody can be involved. 8 just got kind of unruly and people didn't really say a lot.
There was a question about whether the second round went back to the same people or different people, I think.
Oh, it was all different people. And for the second round, we wanted to get feedback on our Spanish language messaging. So we had 2 of those focus groups were with bilingual English Spanish speakers. So it was all different. We did a new recruitment push every time we did a focus group.
Okay, thank you so much. This one is for Shrima. This topic came up multiple times. Are the effects of alcohol consumption cumulative over the lifetime?
Yeah, so I answered that on the Q&A, but yeah, so most of the research looking at alcohol and breast cancer has been using surveys and asking women basically what their pattern of drinking is over the last year, and a few asking when women started drinking. It does appear that the longer women have been drinking, the higher their risk, but that hasn't really been, isn't as strong as like a pattern of drinking leading to increased risk of breast cancer.
Okay, so we have about 1 more minute left. And I think this one is for Priscilla or Diane, or for everyone. Someone brought up the tips for making the case to funders in different states and in different areas.
If I might answer quickly, I think that the 3 points that I brought up in one of my first slides, that we know this link is real, and we know that young women are drinking, and we know that they don't know about this, is pretty compelling. And I would also suggest highlighting this as an equity issue. It seems unjust that society as a whole has this information about the possible consequences of a health behavior, and yet people engaging in this behavior don't know that information. I think that might also be a way to help convince funders to put money into something like this.
So I think we're at time. And I just want to thank the panelists. I want to thank the funder, and I want to thank the participants. I'm sorry we weren't able to get to more Q&A. It would be nice to have further discussion, but I hope that you have found this to be valuable and informative, and that the dialogue will continue. Thanks to you all.